Welcome to Game Changers Silicon Valley, a show about today's emerging innovations that may be the game changers of tomorrow. Tonight's show is about a personal journey, how a highly qualified, esteemed, and successful surgeon decided to launch a program for the underserved that may turn out to be a major player in providing access to medical services. My name is Jim Connor. My guest is Homero Rivas, the Director of Innovative Surgery at the Stanford School of Medicine. Homero, welcome to the show. At the Stanford School of Medicine, one of your primary activities is to provide surgical procedures to people who have a life-threatening weight problem, generally using the gastric bypass technique. Can you give us an overview of the number of people seeking this procedure and how do people come to the decision to do this?
Very good. Thank you, Jim. It's a great honor to be here. Obesity is a major epidemic. It's actually the first worldwide non-infectious epidemic. So big problem. Here in the US, just to give you an example, we have probably 70% of people are overweight. About 30% of people are obese. And about 18 million people qualify to have what we call weight loss surgery or bariatric surgery. We know that people can try a number of things. It's very unfortunate, however, that most of those things don't really work. And those would include diet, exercise, medication. You could put acupuncture, hypnosis, magic, pretty much anything. Nothing really works. The only thing that works efficiently, effectively, successfully is to do an operation. And that's what I do. At Stanford, we have a fantastic group of people. It's a center of excellence that's led by Dr. John Morton, who's actually the president of the American Society of Bariatric and Metabolic Surgery. And going back to what you said, actually only less than 1% of all those 18 million people actually get to have bariatric surgery every year. There are a number of constraints in the system, let's put it that way. The main one, the demand exceeds the resources that we have. And for someone like me who does weight loss surgery pretty much every day, it takes at least probably 14, 15 years of training before I can actually do that. So we are attacking a well-established problem that, in all honesty, is going to be difficult to just treat it just by a group of us. We need to attend to prevention more than anything.
Let me ask you a little bit about this. Now, it's the 18 million or so people who have this really severe problem. Is that a certain weight? Is that like 300 plus pounds or something like that?
That's a good question. Well, everyone's going to be different, of course. A good way, more or less, for people to understand this is someone who has maybe an excess weight of 100 pounds.
Excess.
But what we actually do is a very simple equation where you can actually get what we call a body mass index, and that's your weight divided in your height to the square, and that's so you can get a pretty much a number. Usually, a number that is normal for most people would be, or ideal, let's put it that way, is anywhere from 20 to 25, and that's only less than 30% of people would actually have that here in the U.S. Most people are going to be in the range of 25 to and above, which is going to be the overweight or obese, and that's what we actually, the people that we actually try to help them.
I wondered about people I've seen who were very large. Was it something in their metabolic system? Was it something that didn't digest correctly? Or is it just the fact that their body got out of control, meaning they were eating far too much and not exercising enough? But is it age related in terms of their ability to address this before it gets beyond the point of no
Very
return?
Good. That's an excellent observation. I mean, the cycle of life, we are programmed in a way to survive. We believe, at least subconsciously, that the more weight we keep, the more we're going to be able to survive, for that matter. As we age, we become less active. We keep eating as much or maybe a bit more because we tend to do better. And so we gain some weight. For the most part, as you age, you're going to be bigger, fatter, with an unhealthy weight that's going to be not good for you. There's going to be certainly, that's the most common thing, that people eat more and they work less. However, there's some other problems, like for example, having a slow metabolism that is going to make you more prone to have or gain some weight, and other medical problems that we always look and make sure that patients don't have before we actually do something correctable with like an operation.
So now you specialize in this gastric bypass.
That's one of the few operations, let's say, that I do.
Okay.
That's right.
One of the few. Okay.
One of the few.
Okay. And is this, shall I say, highly successful?
That's a good question. It's highly successful. If you put in perspective all the different therapies for obesity, which in general they represent approximately $100 billion market in North America.
$800 billion.
Billion dollar market in North America. Okay. The bariatric surgery or weight loss surgery is pretty much the only successful therapy that we have. That includes, in the US for the most part, the use of gastric bypass, which is an operation that we've been doing for the last 50 years, more or less. Highly successful, very predictable results, and patients have usually 70 to 80% of the excess weight they have. So if they have 100 pounds extra, they're going to lose about 70 to 80 pounds of that in the first 6 months to a year. There are other operations that are not as old, let's put it that way, but they're also highly successful. The so-called gastric sleeve, where you remove a big portion of the stomach, you make the stomach look just like a sleeve, so very narrow, very thin. People have a few bites, they feel satisfied, they stop eating. And there were some others that people have tried, like doing what they call like lap band, or putting some balloons. And there's so many other therapies that have come and gone with some limited results.
Are there psychological factors on the people who undertake this or go in this way?
No question. As a matter of fact, it's very interesting. It is difficult once you have a problem of being obese. The way how you can cope with things can be very challenging. So we have to incorporate a multidisciplinary approach to actually be successful. No operation is going to be like a magical solution for this, and you have to incorporate a team of psychologists, a team of psychiatrists if needed, and also dietitians, among other people.
I see. Kind of a behavior change.
No question. That's right.
Interesting. Fascinating. Now, what makes you extremely interesting is you are highly successful, held in high esteem. Everybody knows about your what you're doing at Stanford. And now you one day woke up and said, I want to do something beyond this. Now, I mean, you have full employment. You mentioned earlier there's only 2,000 people in the U.S. who can do this. There's 18 million people waiting, and you can only do 6 a day. And you are absolutely booked through the rest of your life as long as you want to work with a great income and lots of status. And what more could you ask for? But now you had this awakening, it sounds like.
That's
you
right.
wanted to go and do something else. You're not abandoning this highly successful, but you're doing something else. Let's talk about that for a moment.
Well, what I have said before, it is the way I see medicine, and I've been in medicine for the last 30-some years. My dad, he's a surgeon, so since I was a kid, I used to do house call with him, being in the operating room with him. So this is very dear to me. Having said that, we have a very poor business model, I think, physicians in general, in the sense that we work in an artisanal way. We really cannot scale our production. So I have to be in the operating room all day, I have to be in clinic all day, and the social impact that I'm going to have is going to be very limited. Maybe 5 people in the operating room, maybe 10 people, maybe 100 people in clinic, but it's very limited. So what I think is by leveraging on information and communication technologies, we can get to the masses using technology. And so I think, being here in the US, coming from Mexico, I see every day how there's we have a large group with very poor access to care because of the limited number of physicians we have in the US who speak Spanish. And I have felt very compelled in creating a telemedicine company, for that matter, where I can bring access to people, no matter where they are, as long as they're connected, and most people are, access to a care provider who can understand them and who can help them with their medical needs.
So I went to your website, and it looks like for $40, you're providing a online, real-time communication link with an appropriate physician.
That's right.
Or a team that can sort this
Yes.
out. and give you a prescription.
That's right. So it's something very simple. It's not the only telemedicine company that it's out there. However, we believe that we're very disruptive in a way because everything's in Spanish. Everything is not only with the alignment of your language, but truly culturally aligned. And we have a way how we can connect people immediately with navigators who are actually maybe located outside, the U.S., maybe here, but the end point with this is that we will be able to understand their needs and then connect them with a care provider here in the U.S. who can actually give a prescription for that little payment. This we have implemented in a number of consulates of Mexico here in the U.S. with very, very good results after doing some hundreds of patients because they're so happy from this availability of seeing someone in the language.
What are the ranges? What is the range of issues that you can treat? There are obviously some you can't.
That is right. Usually simple things like having types of like sore throat, which is like could be a throat infection, ear infection, urinary tract infection, some belly pain, some headaches, some questions about health, some questions about the medications you already take, some things about that you need a refill for medication. Simple, very simple things like that.
Yeah, that's tremendous. You've got two co-founders on your website?
That is right, yes. Both of them, they have worked with me. We started from the very beginning, and one of those is Eric LaRue. He's an emergency room physician from Stanford, and the other one is Obed Esparza, who is not only a nurse, but he's also a PA, physician assistant. So both tremendous assets and founders of the program.
And is it based here in the Bay Area?
Based in the Bay Area.
But
that's
you can
right.
expand it to anywhere. It can be any center.
That is correct. First only in California, and then we're expanding throughout the southwest of the U.S., which makes more sense for the Hispanic community, of course.
That is great. That is wonderful.
Fantastic.
Well, we're going to put up a copy of our webpage so people will know how to reach it at www.doctalk and your contact information there. And I want to wish you every success. It's a very admirable, and I enjoy the story of a guy who has no reason to go outside his specialty, who says, I'm going to go outside that area where I'm comfortable and do something I believe is for the good of the society. So congratulations to you.
Thank you. I'll visit you in a few years and you're going to see great success.
I believe I will, and I look forward to that. So thank you very much, Homero.
Thank you, Jim.
We'll talk soon and keep in touch with you.
You bet. Thank you.
I'd like to thank you for joining us for this week's episode of Game Changer Silicon Valley. Each week we'll address an area of innovation that may emerge as a game changer of tomorrow. You can follow us on our Facebook account or subscribe to our YouTube channel. We look forward to your continued interest and participation in upcoming shows.